Hi, I'm Dr. Mark Pyfer from the Cataract and Primary Eye Care Service at Wills Eye Hospital, coming to you live from the American Academy of Ophthalmology meeting in 2015 at the Wills Eye booth here in Las Vegas. I'd like to tell you a few things about the key elements of the meeting for me. As an anterior segment cataract and refractive surgeon, most of the new research is presented at our specialty meeting. So the Academy meeting is more about making business connections and forging relationships. That being said, there are some updates on some new products that are going to allow us to provide better vision for our patients after cataract surgery and to diagnose problems and take better care of our patients. So I'd like to tell you a little bit about those. First is the Symphony Iol. This product is already being used in Europe. It's made by Abbott, proprietary technology to correct for chromatic aberration as well as spherical aberration. Chromatic aberration in a standard lens means that different colors of light are bent slightly differently, which blurs the focus. This lens corrects for that, improving quality of vision and improving depth of focus. It's already being used in Europe. The results are exciting. The final submission to the FDA has been made, so we're anxiously awaiting approval of that lens, hopefully within the next year. The other similar product that is being used in Europe is a laser by Zeiss called the VisuMax, which is used in a procedure called SMILE. SMILE stands for small incision lenticular extraction. It's an alternative to LASIK to correct myopia or nearsightedness and astigmatism by extracting a small sliver of corneal tissue from a very small opening rather than making a big flap. The biomechanics of the cornea are such that when you make a flap, you may weaken the cornea. This allows us to preserve corneal strength but still correct significant amounts of nearsightedness and astigmatism. Again, this is being used in Europe, 300,000 cases worldwide. The results are very promising. The final submission has been made to the FDA, and the company is saying within the next year we may have access to this product. Another development in practice management front is the Academy's IRIS Registry. I'm participating in this in my practice, and this allows us to collect data on patients anonymously, incidence of diseases and outcomes after surgery, and the enrollment has been very strong. We're still learning what to do with the so-called big data that's being collected, but we're working closely with the Academy members who are heading up this program that will not only allow the data to be collected across the entire country, but to actually feed back to individual practices to kind of benchmark where they are compared to others. So this is exciting. And finally, we've forged a relationship with a small company that's located very close to Philadelphia called Macular. They make a device that measures dark adaptation very quickly, and the significance of this is that we can measure the health of the photoreceptors functionally. We're pretty good at looking at the structure with OCT and our clinical exam, but function is often hard to elucidate. The primary problem with photoreceptor function, primary disease that interferes with photoreceptor function is macular degeneration. So it's very important for a cataract surgeon to be able to identify early age-related macular degeneration in patients prior to cataract surgery, because the symptoms of cataract, namely decreased clarity of vision, night vision impairment, are very similar to symptoms of early macular degeneration. This would allow us, for instance, to avoid putting a multifocal lens in these patients and perhaps to watch them more closely and refer them to a retinal specialist for treatment, or at least to avoid vision loss if possible in the future. So these are the key things for me, and I'll tell you that it's been a very busy meeting. We start early in the morning, go late into the evening. Saturday night we had our Wills Alumni Society reunion and reception, which was, we broke records for attendance. We've been to users group meetings for the products we use, such as the femtosecond laser, the Catalyst femtosecond laser at Wills. And we even managed to squeeze in a little social time and time for a few rounds of blackjack or roulette. So.